All right, today we're going to dive into a really cool story about how a major healthcare provider, USI, tackled a massive customer support crisis. But their solution wasn't just to throw more people at the problem. No, they brought in a whole new kind of AI, what they call an agentic workforce. Let's get into how they did it.
So just imagine this for a second. What if every single one of your support agents had a perfect instant memory? Like they could recall every little detail about every policy, every doctor's schedule, every insurance plan, across dozens and dozens of locations, all in a split second. Sounds kind of like a superpower, right? Well, that's the core idea behind the solution we're about to break down. Okay, so let's set the scene. The company at the heart of this is USI. They're this huge network of over 60 eye care clinics, and they were growing like crazy. But all that success came with a pretty serious side effect. Their patient support center was just getting completely swamped. It created this huge bottleneck that was really starting to hurt the patient experience.
And wow, when you look at the numbers, they really tell the story. Before they brought in this new system, the average patient was waiting on hold for 4.5 minutes, just for an agent to find an answer. Because of that, only about 62% of calls were getting resolved on the first try. And maybe worst of all, 11% of people were just giving up and hanging up. That is a lot of unhappy patients. So you might be asking, why was it so hard? Well, the complexity was just off the charts. You've got different clinic hours, ever-changing doctor schedules, unique procedures at different locations, and dozens of insurance plans that seem to update constantly. So you've got agents literally digging through thousands of pages of PDFs while a patient is just sitting there, waiting on the line. So that was the problem. Now, let's talk about the solution. USI brought in an AI system called Raia. But here's the thing, this is not your average chatbot. It's what's known as an agentic workforce. And you should think of it less like a single tool and more like a whole team of virtual experts, ready to help their human teammates at a moment's notice. And this is a really important concept to get. What is an agentic workforce? Well, it's not one giant AI trying to do everything at once. Instead, it's a system made up of smaller, specialized micro-agents. Each one has a very specific job, and they all work together to handle complex stuff, pretty much exactly like a super efficient human team would. And here's what that AI team actually looked like for USI. You had your main call assist agent that could search something like 8,000 documents instantly. Then you had the specialists, right? An insurance lookup agent could verify a patient's plan and copay, and a procedure prep agent could pull up the right instructions and even text them to the patient right then and there.
And get this, the whole thing went live in just 5 weeks. I mean, that's incredibly fast. 2 weeks to get all the documents ready, 2 weeks for the AI to just shadow the human agents and learn, and then boom, live in week 5. That kind of speed is a huge, huge deal because it means you start seeing the value almost right away.
All right, now for the part I know you've been waiting for, the impact. What actually happened when they unleashed this virtual workforce? Well, the results in just the first 90 days were, well, they were pretty transformative. Let's start with that search time. Remember that 4.5-minute average wait? Yeah, that got absolutely crushed. It plummeted by 80%, down to under 55 seconds. That's almost 4 full minutes of dead air just erased from the call. The AI was finding the answer before the human agent could even finish typing the question. And that amazing speed had this huge ripple effect. Because agents suddenly had the right info, right away, the first call resolution rate just skyrocketed. It jumped a massive 27 percentage points, going from 62% all the way up to 89%. That means way more patients got their problems solved, start to finish, in one single phone call. Then there's the impact on the team itself. The AI basically provided the capacity of about 5 full-time human agents. Now, this is the key part. This was not about replacing people. It was about empowering them. It meant USI could handle those crazy peak call times without burning out their staff or having to go hire and train 5 more people. That's a huge operational win. So let's zoom out for a second. What's the big takeaway here? This whole case study is a really powerful glimpse into the future of customer support. And that future looks agentic, a world where our human teams are supercharged by these specialized AI partners to deliver service that's faster and more accurate than ever before. You know, the VP of Patient Services at USI just nailed it when they said every support rep has a virtual expert at their fingertips. And they pointed out that the crucial part wasn't just the numbers on a spreadsheet, it was a real tangible improvement that the patients themselves could actually feel.
And for them, this is really just the beginning, which is so cool to see. The plan is to keep expanding the AI's knowledge, teaching it about things like LASIK financing, adding a Spanish language pack, and even using analytics to figure out the most common questions so they can be more proactive.
So, all of this leaves us with a really fascinating question, one that gets to the heart of the future of work. When the AI becomes the instant expert on facts and data, what's left for the human to do best? Maybe, just maybe, it frees people up to focus on the things that humans are uniquely good at: empathy, creativity, complex problem solving, and building a real connection. Definitely something to think about. Thanks for tuning in.